Hi, Matt.
All right, ready? So subcutaneous injections is the same. You have to have your provider order with you. You have to go through the 4 label check. You have to go patient rights. All of these confirm. You talk to your patient. You confirm your patient identification. I'm going to go ahead and ask my patient if that's okay to touch them, and then I'm going to find the measurements. Okay? Is it okay for me to touch you?
Yes.
Perfect. So would you mind actually standing up for a second? I mean, never ever have your patient standing or. Why do we not have want our patient to stand when they are giving you immunization?
Because they pass out.
Yes. What is that term? Syncope. Good job. We don't want because of the syncope, right? So you always want to make sure that your patients are sitting down or lying down. Okay. The only reason I want to show you guys so you can all see it. So I'm gonna go ahead and grab Matt's arm. I'm just gonna lift it arm. I'm just gonna have you bend it for me, please. Perfect. So from here, my hands might be cold. From here, you always relax your hand. Relax your hand. Let me hold it for you.
I am.
This is like, there you go. Okay, perfect. So this is the area that I want to go. There's different methods that you can find the landmark. So I always kind of like feel the subcutaneous tissues first. And then another method that I'm gonna do is, can I roll this up?
Yeah.
Okay, go ahead and turn around so they can see it. Another method is you can bring your thumbs together and from the pinky to the pinky. But people sometimes can make a mistake. They go all the way to the shoulder. The pinky is not supposed to go all the way to the shoulder. It's under the axillary line. So Matt's axillary line is right here, and my other pinky is going to be right where the IC joints are. Wherever your thumbs are meeting, that's the area you want to inject your patient for sub-Q. That's one way. Another way is you're gonna grab 4 fingers right after the patient's axillary line, and then 4 fingers from the AC joints, and that's gonna be right here poking your patient. That's 2 different methods. So you see whichever works best for you. Once you find that area, you can go ahead and clean it. Put the alcohol wipe facing towards that area so you don't lose it, okay? So Matt, go ahead and bring your chair high for me and have a seat, please. I'm gonna go ahead and draw my medication. So I brought 2 different syringes to show you guys in case you are going to your patient room drawing the medication. I checked my medication vial, everything is good. I'm gonna clean my alcohol, get my alcohol wipe, clean my vial. I have my right syringe. So I have 2 needles in here. This one, remember, the only time you're allowed to use this kind of needles that they don't have a safety is when there's no other methods available, right? So the provider says 0.5, whatever injection. We're gonna go ahead and open them. I don't need this. Facing down, inject the air into the vial. Then we draw our medication. I'm past the 1.5. There's no bubble or anything. So I don't want to waste my medication. I'm gonna go ahead and inject that back into it. I'm gonna take, oh, I shouldn't have thrown my needle away. I shouldn't have thrown the cup away because I needed to do single hand scoop and twist that, right? Now I'm gonna grab my brand new needle. I'm gonna keep this so I can go to my patient room and they can see that this is brand new, okay? I'm gonna grab my Band-Aid here. Child proof. All right, this is ready. I'm gonna grab my other alcohol wipe, and I'm gonna always have my gauze ready. All right, Matt, would you mind facing the board, please? Perfect. I'm not really comfortable him sitting down like that. Is this comes any higher?
This is as high as it was.
Okay, try that one more time. Because I have back issues, so if I'm not comfortable, I'm not gonna make my patient comfortable. Actually, do you mind turning around one more time? So remember, you don't want the patient to hold your arms. You want them to have it loose. So I'm gonna grab this arm and I'm gonna bring this arm over here. I want you to put all the weight from this arm on this one, okay? So sometimes, there you go, because we don't want any tense on this one, okay? Go ahead and face the board, please. Perfect. I'm gonna, you guys can't see, so you might have to come this way. I'm gonna go ahead and find my measurement one more time. This is where I wanna go. right where the sub-Q is. Remember, this is one method. The other one is 4 fingers to 4 fingers, right in the back of the arm. I'm gonna grab my alcohol wipe. Start from the area you wanna go. Work your way out. We're gonna make sure we're not touching that area. I'm gonna bring my safety with me. All right, do you want me to count or just go?
You can go.
Safety out of the way, open the cup. And we're gonna have to make sure this one bubble is up. Can you guys see it? Yeah, okay. We're gonna make sure that the bubble is up. I'm gonna pinch very well, relax your arm, 45 degree. The way people a lot of time they start from here as a 90 and they adjust their 45. On 3, we're gonna go ahead and poke our patient. Ready? 1, good job. And safety, sharps. That's it. And a little bandage right here. Few things that you have to keep in mind. Subcutaneous injections are one of the easiest one. But you still, yeah, he says he didn't even feel that. But you still do not want your patient to be, you never know. Sometimes they might not be feeling well, they might faint. So you never really want to trust the patient. Try your best if you can. Figure out a way that works best for you. I don't like getting on my knee, so I'm a lot more uncomfortable. So I always use my exam bed. When the patient is on the exam bed, you can have them lie down and just like hold their hands in the back. That gives you more support. Just have them lie down and this whole arm is going to be on the bed. Especially with kiddos, okay? You can relax now. Any questions? Yes, Nicole.
Do we pinch or no?
You pinch.
Okay.
I also sometimes, let's see if I can find another arm. Thanks, Matt. No, I need a particular, no. Cheyenne, can I use yours, please?
Yeah.
Would you mind rolling your sleeve up? So even with Cheyenne, she's not a heart patient. You still can see it, but may I touch you?
Yeah.
But sometimes if you're bodybuilders, it is so hard. You guys remember Musa? He was my patient for it. Bodybuilders, it's so hard to find that subcutaneous layers in there. Super duper hard. So what I do is go ahead and stand up if you don't mind. I'm just showing them and turn around towards the, go ahead and put your arm down. Perfect, thank you, just relax, okay? So a lot of times, if I'm right-handed, so I put my thumb all the way the other side of Cheyenne's arm, and I'm just gonna kind of like pull the tissue and twist it a little bit. Because I want to grab as much subcutaneous as I can. Again, I have in here some with Cheyenne, but some people you are not going to be able to find any. Because the activities that they do, this is all muscle. Alright?
What do you do in that?
You just have to try your best to twist it a little bit so you can grab them a little bit of that sub-Q. You don't want to go on the muscle because now medication is not going to help. Right? Any other questions? No?
So in that case, then, would it be like a 5/8 of an inch needle that
Yep.
you would use because you wouldn't want anything to go?
They're always 5/8.
Oh,
They're always. Because 1
So
inch
would
is
you-
going to push it to the muscle.
Would you go in all the way then, if you had somebody
Yes.
with really big triceps? And
You
like,
still will go. Yeah.
Okay.
Yeah. Because if you're not going all the way in, there's a chance that you're going to lose the medication.
Okay.
And you do not want to lose the medication. The needle is very small. Okay? Any other questions? Per provider order, subcutaneous injection or medication, whatever you give to your patient, was given to patient's right, left forearm. Patient was observed for 15-20 minutes, whatever you want to say. Remember, it can't be 15 to 20 minutes. It has to be 1. Patient was observed for 15 minutes, tolerated well, no further questions, provider notified. Okay, because you have an order. So this is not that you have to write every single, you have an order. This is, doesn't matter if it's injection or medication, you have to have an order. Okay, the provider order is in there. So you're just doing your recommendation that you observed your patient and they did good. Any other questions? No? Okay, perfect. Thank you. Thanks, Matt, for being the guinea pig.